professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment with Ross University School of Medicine. And in this video, I'm happy to present and announce the specialty, the new specialty that we've built. And there were countless hours, I shouldn't even say hours, countless years that were spent in planning this specialty and providing the opportunity for students to be able to go into some of their interests. And the idea is similar to having an elective. And so, again, I said countless number of years. This idea has been floated around through many Walden iterations and many different leaderships. And so now finally we have gotten to this point. And actually along the way, I even got a registered environmental health specialist, registered sanitarian certification in order to gain expertise in this. Anyway, so we talk about many different, and in this in this description, of course, it doesn't do it justice. It doesn't do justice to what we have built. There's just so many highlights in our courses, and I really hope that those of you that are going into our PhD program explore this as an option, because let's face it, environmental health really has come to the forefront, especially currently. And the reason being, many nations have come together to finally agree, and fortunately our administration is on board to reduce emissions of many different gases, and also be able to at least slow down global warming and climate change. Of course, contaminated drinking water, we talked about not only Flint, Michigan, which was the start of many of the cases of lead poisoning, which was appearing in children, but also looking at the drinking water. For instance, I'm going to give you an example. In Pennsylvania alone, the drinking water in 10 cities, approximately 10 cities across Pennsylvania were measured. And at one point, the water quality and the amount of lead and contaminants was more than what was found in Flint. So let's put that into perspective. Water, in and of itself, going through lead pipes and others, containing some of these heavy metals, and also purified drinking water. If it's coming from a source where there's lead, then this can lead to exposure. Polluted air, of course, I've done several original research projects, and you'll find the important thing and good thing is that you'll find examples of not only videos, but original research projects completed by Walden faculty members, and providing original research to explain some of these concepts, which are very difficult, and environmental health is very complex. So, what do we move on with? What is it that you're going to be looking at in the environmental occupational health? Well, there's an environmental and occupational epidemiology, and of course, in conversations, kind of built the modules, and we start off by talking about some of these highlights, for instance, lead in water and others. But we also talk about, which is interesting, the occupational health side of that. So there's almost like two sides to the same coin, heads and tails. Well, one side is the environmental health exposure through such as lead paint chips or such as lead drinking water. But on the adult side, there's actually an occupational hazard that people need to be putting into consideration. And so this was included in one of the courses. And then some of the potential disaster management, lot of it. So this is chock full of very important case studies, information to bring home the point that the environment matters. And this goes right back to social determinants of health, because the place where we are born, live, work, and this is work, but all of the portions of your life course, you are being exposed to the environment. And the fact of the matter is, the environment not only affects at the organ system level, different organs. So if you're coming at it from a medical perspective, but also at the cellular level, at the genetic level, and epigenetic expressions. So there's a whole gamut of these things. All of these ideas are very important to be thinking about when you're thinking about environmental occupational health in one way or another. This was part of this, and also law and policy, looking into that, toxicology. All of these are especially important within this specialty. Um, and a lot of the planning, myself and others were involved in trying to make sure that the right courses were in the curriculum. And we had a lot of conversation a number of years ago, trying to make sure we had the right fit. And so we actually canvassed and looked into many of the major universities and the courses that they were offering. And from about 10 universities, we selected these to be the final four that we were going to present in the specialization. So there was a lot of vetting that went on, and I just wanted to communicate that to you so that you understand that this is a course that was well thought out. This is a course series that was well thought out, and hopefully delivering and providing you with some insights about how the environment affects human health and even animals. One health can play a role in all of that. Thank you for listening.